Go ahead. Welcome, friends. We're just going to take a minute to let everybody get into the Zoom before we start. So I ask for your patience while we wait for a few more people to join us. Okay, I think we'll get started now. Welcome back to our webinar on data triangulation. This is the second webinar on data triangulation and how we can use it to improve immunization supply chain management. So just a reminder that today's webinar is being recorded, and we will share with you in the follow-up email the recording link and the slides that are being used for the presentation today and any other resource materials. So rest assured that you'll get those. My name is Barbara Lamphere. I've met several of you before, and it's good to have so many people returning for this webinar. We had a great webinar last week on data triangulation, and we're looking forward to taking this one step further as we look at how we can apply what we learned in data triangulation to your own immunization programs. Today, I am joined by my colleague, Adriana, who will be presenting work that the staff from Ethiopia's EPI have done to use data triangulation to strengthen their immunization supply chain. Adriana, do you want to just briefly introduce yourself?
Thanks, Barbara. Hi, everyone. Welcome back to part 2 of this webinar series on data triangulation. My name is Adriana Almignana, and I am a technical officer with JSI. I've been working with the Immunization Center, focused on projects and activities that are improving routine immunization and new vaccine introduction. Glad to be with you here today.
So this is just a reminder that we have 2 more webinars coming up in the series after this mini series on data triangulation, one in March and the last one in May. And we hope you will be able to join those webinars. I will send the information about registering for those webinars in my follow-up email, but those 2 webinars on data technology applications and on data use in coordinated supply planning at the country level. So we hope you can join us for those 2 webinars and the last 2 in the series. Just a reminder, and I know many of you do this already and it's great. So as you come on, please introduce yourself in the chat. Tell your colleagues your name and where you work, and that we'll get to know who's here in the group. And then we will have time at the end of the presentation today for questions. So if you have questions, please use the Q&A button at the bottom of your screen. Now let's move on to today's webinar. So a brief review of the objectives of the webinar. Today we're going to discuss the challenges and lessons learned in application of data triangulation for immunization supply chain. We're going to do this through a case study, a country case study, and Adriana is going to be presenting about the Ethiopia work, as I mentioned. And then we're going to do an interactive activity with you to explore options for how to do data triangulation and how to use it in your own situations to improve your immunization supply chain. So we hope that you will be able to apply what you've learned in these webinars. Let's do a quick review of some of the data triangulation concepts we discussed last week. Let's first start with the definition of data triangulation. So data triangulation is a synthesis of two or more existing data sources to address relevant questions for program planning and decision-making. It's really about turning data into reliable information for action. We may find limitations in any one data source or data collection methodology, and data triangulation gives us a process to address those limitations of those data sets. And it also encourages deeper insight into making sense of complementary information by comparing it and by analyzing it together. And in the broader context may lead us to some solutions to some of our big questions. Data triangulation can be done at any level in the system. It can be done at national and at subnational levels. If you have access to data and need to make decisions, data triangulation can be used. And it can be used in your routine review of supply chain performance. And we will hear more about that when we hear about the Ethiopia case study example that Adriana will present. And here's the diagram we saw last week. The process of data triangulation starts by identifying the question, the issue, the supply chain problem you want to explore, and for which you want to find a solution. The second step is identifying the data sources. These are usually could be existing data sources such as LMIS, DHIS2, possibly service data and microplans. In step 3, by analyzing and comparing that data and considering the local context, hopefully you arrive at the answer to your question, the possible reason for the supply chain problem. And then step 4 is very important, and that's taking that analysis and turning it into an action to solve the problem or the question you're asking. So now that we've had a brief review of what we discussed last week, I'd like to turn the webinar over to Adriana to tell us about the use of data triangulation in Ethiopia.
Great, thanks so much, Barbara. So I'm going to present out a country example of JSI's experience supporting Ethiopia staff in triangulating immunization program and supply data towards better data use and improved decision-making. Next slide. So in Ethiopia, the Ministry of Health's expanded program on immunization, or EPI, has administrative immunization program data that's reported in DHIS2. And there's also a mobile-based system called Embrana for the LMIS, which records immunization supply chain related data. And this is managed by the National Pharmaceutical Supply Agency. So there are persistent challenges with the timeliness, the completeness, and especially the quality of immunization data. This is a known challenge. And at the same time, we were seeing that these data were being reported through these different systems to different departments. And often the coordination and the data sharing between those departments was quite limited. So, what we found was that this really meant that EPI program staff, particularly at the subnational level, at that regional level, they were not consistently able to incorporate supply chain data into their decision-making processes. So And in addition to that, the review or the use of data overall for program improvement, it was not always consistent. Next slide. So JSI held a consultative workshop with regional level stakeholders in order to conceptualize a regular process for analyzing immunization program and supply data. So what we did was we brought together key staff from different departments who were not always collaborating together. Some were, staff purely focused on immunization. Some were very much focused on supply chain. Others were focused on the health information system and, in making sure that data within DHIS2 was input. So bringing everyone together to discuss as a group what those data issues were was a really important step for us. So, essentially the group discussed what these kind of key issues and barriers to data use and data triangulation were. And they came out with a few key outputs from this workshop. So essentially what they did was they identified some key indicators that they knew that they wanted to analyze and triangulate regularly. Second, they developed a regular collaborative process for data triangulation. And then third, they also conceptualized a tool that would be able to help in the analysis of the data. Okay, so the group at this workshop basically came up with a short list of indicators that they wanted to regularly be tracking in order to make this monthly analysis targeted, as well as feasible in terms of workload. So they knew what the problems were that they were seeing in their data, and they wanted to be able to monitor this regularly by looking at the same triangulation indicators month after month. So once they had chosen their few indicators, they also thought through what was the analysis or the interpretation of them, of what those possible indicators could be showing. And then they came up with suggested actions as well that they could take based on what they were seeing in the data. So I'll go through one of the examples here on the slide. One of the indicators here was the ratio of doses administered and doses issued. So just taking a look at this example, if you had doses administered and stock on hand in the previous three months, as 135, for example, and the doses issued in that period was just 120, then over time, those numbers should really be equal. And if they're not equal, if that ratio is more than 1, then this could indicate some kind of data quality issue, or perhaps a over-reporting of doses administered. And so the suggested action for that might be to investigate the reasons of, why is this happening within this district, and then provide support either to recode that data, or perhaps even having supervisors really incentivize accurate reporting versus high reporting. Right, so that's just one example of the kind of indicator they were using and the interpretation that went along with it. So they basically mapped out all of this for each indicator to help with the interpretation and the action on that data, and then they got started. So next slide. Great. So this graphic shows that the regular data triangulation process that was laid out. This was a process that happened on a monthly basis, and we'll dive into this to take a closer look. Great. So if we zoom into the first piece of this monthly process, essentially every month at that regional level, vaccine supply data from the Imbrana system and immunization program data from DHIS2, they were sent to the EPI staff person at that regional level. So that we, for this particular activity, we had the EPI staff kind of leading and facilitating the whole process. So that was first, they would receive the monthly data from the different departments. Then next, the EPI staff would then import that data into an Excel tool that we had developed to be able to merge the data together and to help facilitate the analysis. And then a meeting would be called. So the group would meet, so that cross-departmental data triangulation committee. So those staff that were focused on the focal points for immunization, for supply chain, and for data, they would meet together to review the data, discuss, and determine what actions were needed. Next. So after the meeting, then you may have had assigned staff that would carry out each of those action items, right? So depending on the problem or the issue that was surfaced during the meeting, the action items might have been different. So we have a couple of examples here. So perhaps one action would be that staff would need to discuss with certain districts on ways to improve data quality or data completeness issues. Or, maybe another action item would be that a certain staff would be assigned to conduct a supportive supervision visit to address some gap that had been, revealed through that data analysis. It might have been a problem with stock management or other issues. So the idea here is that the triangulation analysis was really driving concrete actions at those lower levels. So it was allowing these managers to really better pinpoint and prioritize their support in order to improve the management and delivery of EPI services. Next slide. And then last in this monthly cycle was that essentially the whole thing would repeat again the following month. So, and at that next meeting, it would start with a report out of, how the previous month's action items were carried out or how they were progressing. So, essentially we supported the rollout and the implementation of this monthly process in two sub-national areas of Ethiopia. And this included, developing that tool to help facilitate the analysis, as well as providing ongoing support for that cross-departmental data triangulation committee at their monthly meetings, providing that ongoing support. And so after several months of implementation, what we did was we wanted to document what we learned through some key informant interviews, as well as a review of the meeting minutes and the data. And I'll share some of those findings now. So what did we find? So we found that, the use of triangulated data really prompted decision-making as well as concrete actions to improve immunization. This was really encouraging to see, even just after some months of implementation. It was a relatively short period. And I'll share a couple of examples of what those outcomes were in just a minute. Another finding was that the simultaneous review of immunization coverage and supply data, this was a new process. And the health staff really saw clear benefits to doing that regular analysis of triangulated data. They really felt that the data was more accessible than it was before, and that it was really being synthesized and being done regularly. So they were able to lead the monthly meetings as well. And although it took some time, their familiarity and their comfort with their skills also improved over time. And then finally, there were some big challenges that we had with the availability of vaccine supply data. So there were a lot of issues that were happening at the time that was affecting the availability of data on the supply side. And so what this meant is that, they couldn't leverage the triangulated data fully. They couldn't do every analysis that they wanted to because of that incomplete data. But the positive thing was that this triangulation process actually was what helped prompt collaboration to help start addressing this gap that they were seeing. Next slide. Okay, and so I just wanted to go through a couple of just example outcomes that we saw from this. So one of the documented outcomes was from an expansion of outreach services. So, this in one area, the team had identified lower than expected coverage in one town, despite having adequate vaccine supply. So they, contacted with the immunization officers in that town, and they worked on identifying the reasons. And what they found was that really it was a result of poor planning, as well as having a shortage of outreach sites. So, as a result, kind of in collaboration with that district health office, the regional office and the district office worked on the launch of additional outreach sites for that district. And next slide. Okay, so then in just another quick example, this kind of data triangulation process had revealed that there was a small town in an urban area that had poorer performance compared to some of the other areas that it was near. So again, they investigated the cause and realized there was a supportive supervision that was done. And they realized that some of the immediately neighboring communities had recently been rezoned into the town. And so this had meant that there were now kind of much higher numbers of immunized children or under immunized children. And so then, as a result of that, the town essentially immediately recognized the need to revise that target population to adjust for that change, and as well as adjusting the microplan to be able to kind of reach these additional areas that they were now responsible for. Okay, next slide. So, so some recommendations, and I'm just wrapping up here. These were kind of early findings, but we thought that they really showed the promise and the potential of using triangulated data on a regular basis in order to address immunization challenges or problems. So based on this early experience, we have a few recommendations for others who might be considering taking this on. So the first is that, EPI managers should really consider incorporating data triangulation analyses into their current data review systems. So being able to kind of integrate this into the data reviews that are already happening, we think would be a great value add. Next, what's really important is to determine practical and feasible means to operationalize the regular use of triangulated data, and particularly at that subnational level. This was a really helpful way for that regional level staff to be able to kind of give more targeted support to the districts, and the fact that they were able to incorporate this into their regular processes was just the most practical way to do it, that wasn't going to unnecessarily add to their already large workload. And then, and part of another aspect of this in terms of, practical feasible means to make this happen. You know, part of that is understanding that the issue of data availability. So in order to optimally triangulate data, right, it is absolutely essential to make sure that there's going to be regular reporting of the data into those data systems that you'll be using for your analysis. So that kind of reliability and the availability of data, that's kind of, you know, that's step one in terms of figuring out how to incorporate this as a regular process. So another recommendation we would have, you know, we recognize that more work needs to be done around relevant indicators as well as the analysis that might be most useful. So there was some indicators that we had started to work with, but I think there's a lot more that could be explored in terms of what could be useful to look at on a regular basis. And then, you know, lastly, if you are going to incorporate data triangulation processes on a regular basis, as they advance and as they scale up, they really should be integrated into current health information systems in order to be properly institutionalized and sustained. Next slide. Okay, so overall, this was just one approach that was taken to try and routinize the use of triangulated data. You know, again, this was one approach. There could be many ways that you could try to incorporate it within your level, within your country. And we know that, you know, more work needs to be done to kind of document this, including at more advanced stages of implementation occurring over a longer time. We were really only able to implement for less than a year. But, you know, from our experience, I think I would like to share just a few parting thoughts on some key things to consider if you're thinking about establishing a data triangulation process. So, you know, first and foremost, probably, really can't stress enough facilitating that collaborative decision making. So break down those silos across departments. You may need to kind of work with new people that you haven't worked with before, but everyone brings their own strengths, and it really helps. You know, it helps us look at problems in a different way. We're bringing together data from different sources, people with different expertise, and together that problem solving is really much better than any one department could have done on their own. You know, along with that, another thing to consider is, you know, how can we make it routine? The more that you do these types of triangulation analyses, the more familiar staff are, and the better you get, the easier it gets as you make it a regular data use process. Third, attention to data availability and data quality. Like I said, we felt that this was a really good process to help kind of highlight those issues and help have some collaborative problem solving around particularly, you know, data quality and data related issues. And then lastly, also very important is focusing on concrete actions. So, you know, if you're undertaking this process, what is it that, you know, is in your power to be able to, what action to take that action? So what action can you take at your level to enact the change? And yeah, so I think that may be it from me. I think we may have a few minutes now.
Thank you.
Yeah, on questions and answers. And I think I just want to share quickly that we've also written up our experience in a short brief, and I can go ahead and link that in the chat, and we can make sure to share it with the other resources.
Great, thanks, Adriana. And we have a few questions that have come in while you were giving the presentation, and we'll address those now. One of those was, what are some of the challenges encountered with the data triangulation process at the lower levels, and how would you be able to address those challenges? So,
yeah. So, I mean, I think I had touched on some of the challenges, you know, that we had, like with some of the, you know, the data itself. I think that another thing was just, you know, at the beginning, I think it did take some time to sort of get used to doing this type of analysis, and it did take time to kind of master those skills and processes. But I think that was part of why we really focused on kind of saying, okay, we're going to look at these few indicators. And for each of these few indicators ahead of time, we're going to think about, you know, what does it mean if we get this kind of number? What does it mean if we get this, like, you know, low number versus high number, right? And so kind of understanding what possible interpretation of those indicators may be. And then as well, understanding what would be the action that goes along with that, right? So having, what we did was we basically created a table that kind of laid out these indicators and laid out, you know, what does a high score mean? What does a low score mean? And what's the action that might be associated or appropriate for that as well. So having that kind of interpretation and action already laid out at the beginning, I think really helped until the point where, you know, the staff could be kind of, they were, you know, used to this process, used to doing this analysis, and it maybe came more naturally.
great.
And yeah, I think, yeah.
Okay. There was also a question is, what if the same data are contradictory from different sources?
Yeah, so I think this is a great question. I think it came up last week too. Right. And so I think that that's an important piece of I think I would say both like steps 2 and 3 that Barbara showed at the beginning, identifying existing data sources and then kind of summarizing the data. So I think we'll often find that you may have data that may be either contradictory or they don't quite line up how they should. And I think that's a very, very important piece before you get started, is kind of not only identifying what are those data sources, but also weighing, like, what are the strengths and limitations, right? So if you have these two data sets that are not really speaking to each other how they should be, you know, what do we know about the quality of one source over another? What do we know about the current situation on the ground versus when this data might have been collected? So I think you all are in a really great position to know kind of the behind the scenes strengths and limitations of those data sets. And I think, so one, kind of considering that, I think, is an important step. And then 2, if you're not totally sure, doing some kinds of internal data quality checks can also help kind of figure out, well, how reliable is this data source that I want to use, right? So for example, in DHIS2, if you're not too sure about the quality of that, well, you can also do some kind of comparison of different indicators within that same data set that maybe should be equal. So for example, I think Timoteo last week shared an example of comparing Penta-1 to PCV1, because those vaccines should be, you know, in Mozambique, those vaccines and many other countries, they're administered at the same time, right? So the child should receive both vaccines at the same time. So if your Penta-1 and your PCV1 are totally off, then you know you've got a problem with DHIS2, right? So there's it's not an exact, you know, it's a bit of an art and a science, I guess. But I think kind of those, taking into consideration all those kinds of factors before you get started is really, really important. And it's actually just part of this process as well.
So I'm going to take facilitator's privilege now, and I'm going to ask a question because data quality and incomplete data were issues both in your presentation, your experience, and in Timoteo's presentation last week. Did you see any change in the quality of the data as more triangulation activities were taking place? Did the use of data and knowing that it was going to be triangulated help improve data over time, or?
Yeah, and I guess I would say yes, but it wasn't an overnight process, right? Mm-hmm. So I think we had, at the time that we were doing this activity, there was a lot of kind of contextual issues going on with some of the data reporting systems. There was conflict in some of these areas. So there was a whole host of reasons why that data availability had kind of gone down during just before we started to implement, basically. Mm-hmm. And so it was a big issue, right? And so they worked over time to be able to improve the availability of that data. So, like I mentioned, they may not have been able to do every analysis that they wanted to because of that incomplete data, but they kept working to try and solve that broader issue of data availability. And over time, they were starting to see that, some districts were starting to report more regularly than they were before, right? But again, it's not something that happens overnight. And I think the other thing I would say is that sometimes it's just worth getting started. So even if you've got, you don't have to have perfect data to get started and to start that collaboration, to start talking about it, and to start figuring out what you can do to kind of improve those problems.
Right. Thanks, Adriana. We're going to stop with the question and answers right now so that we can have some time for our interactive activity. But I want to say that we will answer the questions and send those in the follow-up email, those that did not get answered already. So let me introduce this interactive activity. So we are going to be doing an activity with you all to really discuss, to have you think about how you would apply what you've learned in these last two webinars and to your own immunization supply chains. But first, I'd like to introduce some of our panelists who are going to add to the discussion during this interactive activity. With us today as panelists, we have colleagues from Village Reach, Timoteo Chaluco, who you met last week when he presented about the Mozambique triangulation activity. Danjing Rong, who is a data analyst with Village Reach. Stephanie Tritz, who is a research associate with the digital solutions team at Village Reach. And from JSI, we have Lisa Oot, from a senior technical officer with the Immunization Center, and Greg Roche, who is a senior technical advisor with the Center for Health Logistics at JSI. So thank you to our panelists. And I'm going to be taking down the slides right now, and we're going to be working using a Miro board or a virtual whiteboard for this activity. So give me a moment, and I'm just going to move to our whiteboard. And if the panelists can just give me, let me know if, I'm sorry, if you're seeing the virtual whiteboard. Is everybody seeing that virtual whiteboard?
Yes.
Yes.
Thanks very much. Okay, so this is going to be an activity that we're going to ask you all as our participants, as the attendees of this webinar, to participate in. And what we're going to do is ask some questions and have you answer. And we want you to answer in the chat, and I'll show you that we're going to capture those answers, and then our panelists will be able to comment on some of your answers. I just want to remind you of the process that we looked at earlier for data triangulation, and that is that we first ask a key question, and then we identify the existing data sources, and summarize the data and local context, and then develop an action plan. So we looked at that earlier today. So what we're going to do right now is we're going to start by asking the key questions. So what we would like from you as participants, thinking about your own immunization supply chains, what are some of the immunization supply chain issues you would want to address using data triangulation? What questions could you answer through data triangulation that would help you improve your supply chain? So thinking of that, please, if you as you think of possible answers to these questions, what are some of the supply chain issues? What we're going to do is we're going to take your answers from the chat. So you would type in the chat and put them on these stickies, these Post-it notes that are on this virtual board, so that others can see what are some of the issues, and we can talk about these a bit. And I'm going to ask the panelists to also help us discuss any of the issues that are put in there. So feel free to add to the chat any of the issues that you have had that you think data triangulation might help. And I want to remind you that, as we said, data triangulation can be used at any level in the system, right? You could be at subnational, it could be at central national level. So let's see what we're getting here. So far, stock utilization and full stock availability have been offered as issues. Okay, so let's see what else comes in as well. So think about, what are you going to be able to investigate through data triangulation?
Yeah, I'm seeing vaccine wastage. I think that's an interesting one. For example, you could ask the question, why are we seeing negative vaccine wastage, right?
Mm-hmm, mm-hmm. Exactly. So we have several availability. Forecast accuracy is an interesting one, and does lend itself, I think, to data triangulation.
Mm-hmm. Yep.
So
these are great topics, and I think sometimes it helps also to form it
as a question,
into a question. Yep.
Yeah. So think about the question you're trying to answer.
Yeah. And the idea here is that you're looking at, data from multiple sources. So maybe if you think about what data you're normally looking at, and what are the pieces that you're not seeing, and how could we have greater insight into that?
Because that's what we were really seeing in Ethiopia at the health facility level, right? That people weren't looking at the health facility. They didn't have ledgers, and so they weren't really looking at their stock. And because data quality was an issue, that they wanted additional ways to be looking at their data.
And Lisa, in that example, what kinds of data things? What data could they compare?
So at the health facility, they have doses administered, so they can see how many doses they have given for a specific antigen. But then they also can look at whether or not what they were administered, whether there's discrepancy there.
And I see here there's one called immunization coverage. I'm going to just expand on this to say, immunization coverage versus stock. If we're just interested in immunization coverage, we can go to DHIS2 for that, no problem. But if we want to kind of understand what that relation is between reported coverage and stock data, we would need to triangulate those sources against each other.
And last week, that was really one of the questions that was asked in the Mozambique situation, right? Is our stockouts the cause of low coverage, right? So that was one of the things that they were looking at particularly. Okay.
And then maybe just one kind of, maybe I can add one really kind of basic question, which is maybe more along the lines of what we were asking in Ethiopia, was you could ask, what districts are having either low performance or inconsistencies in data quality that would require follow-up. It's a bit of a broader question, but
right, exactly. I think we're catching a lot of them here. This is good. Now I want to take us to the next question, and we're going to really think about, so we have several issues noted here. And so imagine that each of you, those of you that have contributed to the problems and issues, if you were in your own situation, what data source would you use in your triangulation? So let's take, for example, forecast accuracy. What would be the data sources that you would compare for forecast accuracy? What are the, what would you use in the triangulation? And so if you want to offer what kinds of data sources you might use in the triangulation, you can put those in the chat as well. And I want you to think really about your own situation, because part of my purpose here is to really get you to somewhat jumpstart you to do this kind of activity in your own situations. So I see that we have distribution plan versus receipt slip. And so, this distribution plan versus receipts, that's going, what problem are we addressing there? We're going to be addressing whether we're distributing fully. Are we actually doing in full as an indicator? So stock ledgers. Okay, so target population. Target population is important, and we saw that last time with our as actually one of the data issues when Timoteo was presenting of some of the data quality problems that resulted because we didn't have a good idea of the target of an accurate data about the target population in some cases.
Yeah, I think target population is a huge one, right? And there's so many ways that you could try to get more accurate target population. So there's a lot of different things you can look at. And you'd want to consider, what do I have, at my level in my country, what's available, and what might be more reliable, or how can I compare all those different estimates of target populations against each other to get a better understanding, right? Some countries may have census, some you may have, community level head counts, which is what we really encouraged in Ethiopia. In some countries, it may even be appropriate to, to estimate using BCG. So I think there's a lot of different ways to look at that target population. I think it's a big one.
Timoteo, do you want to mention anything about how you dealt with the target population issue? And
yeah, target population, it's a big issue sometimes, But I can give an example. For instance, when you are requesting vaccines, imagine that you are in health facility level and you want to request the vaccines for, from the district level, and you have problems with your population data. You can probably use the average consumptions of the previous 3 months in order to estimate what is your level of consumption, and based on that, you can request vaccines for that levels. So this is one of the ways that they usually do in order to try to get out of this problem population, particularly when the health facilities is requesting vaccines from the district level. Yeah. So yeah, what are the things that we are doing? But this is just another example. We are trying to use, for instance, the campaigns data to try to understand what is the gap between the real scenarios on the ground and comparing with the census data that we receive from the statistics institutes. So this data shows that there is a huge discrepancy in some areas, or in some areas here in Mozambique in particular, where we found in the same year that a lot of children received vaccines more than expected during the campaign. But when you compare it with the data that comes from the census for that same particular year, you found this huge discrepancy. Mm-hmm. So yeah.
There's a very interesting problem here that I think came up in our first question. Extra doses from MDV equals negative vaccine wastage. And I know as COVID vaccines are being introduced, we do know that sometimes we get extra doses, and this also happens with other vaccines. And how to figure out, and obviously you're going to get a negative vaccine wastage rate when you've got extra doses. And so how would you go about doing a triangulation activity to look at this particular issue? Does anybody from the panel have a suggestion for how you might sort of investigate this more?
Yeah, it's a great question. I think this is something that you'd want to kind of look at over time. Again, looking at how many doses are being reported on the program side, right? As how many doses administered, and then comparing that with the stock data, and over time having an understanding of maybe an average number of doses per vial that you can use as an estimate. So if in theory it's a 10 dose vial, but really on average, maybe it's around 13 or 14, right? Then kind of revising that over time. But I think it's a good question. I don't know if any others have thoughts.
So I'm trying to see if we've got the forecast demand ratio, and I think that's what the data were, but what is going to be our data source for the forecast demand ratio? What are the two data sources for that? And I think this is going to be relating to how do we figure out our forecast accuracy? So what are
look at the 1-2 over from that forecast accuracy, actual consumed against forecasted demand or plan.
Right, exactly. So that's, and we often do that kind of analysis. So we'll use our consumption records, our reports from the LMIS about what was actually consumed versus our plans, right? Good. Okay. Let's see if there are any other ones that we particularly want to look at here. Why high stock out rates? Why zero stock out rate? Those are interesting comparisons. So if you want to know why there's a high stock out rate or why there's a zero stock out rate, we're going to be looking at stock ledgers. What else could we look at when we're looking at stock out rates? What are some of the data items we would want to triangulate for stock outs to try to figure out stock outs? Any panelists want to comment on addressing stock outs?
One thing that comes to mind is when we think about stockouts, you can think about, for example, stockouts on the day of a supervision visit or stockouts on the day of reporting versus stockouts during the reporting period, and how long were those stockouts. Maybe you could compare, if you have, let's say, a week of stockout at the facility, did your coverage go down because of that? Maybe it just happened that people came at the beginning of the month and no one came towards the end of the month. So that maybe there's a way of looking at which stockouts are impacting. And then of course, you also want to investigate, why did those stockouts occur?
Great, thanks. All right, we have one last question we're going to ask you. And that question is, so in your own situations, I want you to think about, how will data triangulation help you improve your immunization supply chain? What would you hope to get out of a data triangulation activity? And so how would data triangulation help you improve your immunization supply chain? What is your vision for what data triangulation can do for you? And please put your answers in the chat. As to what do you think the benefit would be for your supply chain? And Timoteo, do you want to say about what benefits you've seen so far in Mozambique? Anything that you've seen as a benefit for immunization supply chain?
Oh yes, for sure. As I mentioned last week, using data triangulation, we could find out that at least in particular at country level, that we were having some problems in estimating the country needs when it comes to purchase the vaccines from the supplier. Since one of the vaccines that we had stockouts were being buying together with the government as well with the government. And and the donor, were using like his estimates, to determine the country needs that were not approved by the government. And due to that, we were having a lot of stockouts. So, the data triangulation help us to find this problem, and also to address recommendation or action plans in order to overcome that and improve the availability of this vaccine in the country. So this is one of the examples that data triangulation can help you. But other thing is that during the exercise you may find not only the answer to the question that you raised, but probably other related factors that can contribute to the low performance of your program. Because yeah, sometimes there are many other related issues around, but are covered, and the data triangulation can help you on that as well.
Great, yeah, that's a really interesting thing. I'm enjoying. These are some great ideas that are also being added here. Better data quality would definitely I think be an outcome, and the more as I've alluded to, the more people tend to use data for action, the more the data quality improves just from that use. Also improve supervision, more targeted supervision. You can really pinpoint where those problems are happening and really address those through the supervision activities. So
I just wanted to comment on, I'm seeing a couple of responses on reduced wastage. I think that may be true for some vaccines, but I think it may not necessarily be true for all, right? So For example, for measles, we don't necessarily want a very low wastage rate, because what that may mean is that health workers are actually not opening a vial for every child that comes. So I think depending on the vaccine, low wastage may not actually necessarily be getting us closer to those health program goals. There is, going to be an acceptable amount of wastage that happens, and it's going to be higher for vaccines like measles, like BCG, right? So I just wanted to kind of put a bit of a nuance on that one.
Thanks. Thanks. Okay, we're coming to the end of the hour, and so I'm going to wrap it up here and say that we will share the results of this Miro board with you all, and so that you can see what your colleagues and be able to think and focus on this. And our purpose really here today was not only to share more about the implementation of data triangulation through the Ethiopia example, but also to get you thinking about what you can do in your particular situations. And I hope this inspired you some. So as I said before, you will be receiving a follow-up email with additional resources, a link to the recording, as well as the slides that were used for the Ethiopia presentation, and I will share the PDF of the Miro board. I hope that you will be able to participate in the next webinar, which will take place on March 22nd, and that's on data technology applications in cold chain management and immunization supply chain. And just as a reminder, anyone who attends 5 of the 6 webinars in the series, either live or on demand, will receive a certificate of participation. Many thanks to the panelists for your contributions, for your help in filling out the Miro board, to Adriana for giving us the very insightful presentation on Ethiopia and how to really implement data triangulation. And thank you all for all your dedication and work that you do to improve immunization supply chains. Take care, and we'll see you again soon in the next webinar.
Thank you, everyone.
Thanks. Bye-bye.
Thanks, everyone.
Thank you, everyone. Bye-bye.